Welcome to today's podcast, which again is dealing with the art and the science of discovery. And I want to go back a few years where was working on protocotoic acid, and it's establishing it by animal studies that in fact it was a disease-modifying osteoarthritic drug. So today's topic is protocotoic acid, its role in articular cartilage healing. So I have to go back about 30 years when I was asked to be a consultant on a human clinical trial where they took patients who were going to have a total knee operation in 13 weeks, and they would then look inside of the knee by arthroscopy and create a laceration in the articular cartilage, which would be intended not to heal by any historical means. And they also then made a drill hole in the articular cartilage to see what, in fact, would happen and how fast would that heal. And so then 13, they got injections of recombinant IGF-1, which is a growth hormone that's been known for 50 years to heal articular cartilage. And this was the first study ever done, to my knowledge, in humans. Even all the other ones were done in animals. And so at 13 weeks, then the patient had a total knee. And at that time allowed us to see what did the histology look like of the articular cartilage, that one had a laceration and the other had a drill hole. And on the laceration side, we saw for the first time that there was a incomplete but partially healed laceration. And the reason that's important is that articular cartilage doesn't have a blood supply and only gets the blood in the joint from the surgery that occurred. And because there isn't any potential, quote unquote, for healing from a blood supply, like if you cut muscle or tendon or liver or something like that, we then see on the histology on the slides on the left that the surface has a separation, but as we go deeper in the laceration, we see that there's a sealing of the articular cartilage side to side where there was a laceration. On the other slide, we see the drill hole, and the drill hole shows that over a period of time, it went from an area in the control that didn't heal at all. But on the slide below, we showed that there was surface healing and early maturation of cartilage, like fibrocartilage, and sealed the surface. So with that history, I'd had a long knowledge and history that IGF-1 would really be a good idea if anybody could do that. And so when I learned from seeing rabbit studies that they showed that in Michigan State University scientists, that if they put the dyes of cherries on the rodent cells of the pancreas, it caused them to make more insulin. And so I reasoned that maybe these same dyes, if they were put on human tissue, for instance, synovium, joint lining, that it may cause an increase in IGF-1 or a growth hormone, similar as it did in the rodent pancreas tissues. And so we went to Scripps Institute and we found out if we took the dyes that are red, cause cherries to be red, which are called cyanin and 3-glucoside, and in a petri dish or in vitro, we put this on explants or pieces of human synovium taken at the time of people's total knee. We were able to show that it actually turned a gene on in that synovium and increased the IGF-1 in the culture medium, and we were granted a US patent on that. The problem is that cyanin and 3-glucoside is not readily available in any pure form. It'd have to be about 60% pure and doesn't make it very suitable for carrying on any animal experiments. At that same time, we learned that if you had cyanin and 3-glucoside carbon label, and it was human took it, that within 30 minutes it was protocotoic acid in the human's blood. And so we learned it wasn't cyanin and 3-glucoside, the parent dye, but it actually was the first metabolite, protocotoic acid. And so we then did some rabbit studies in order to show what effect it might have. And so the design of the study was we surgically induced osteoarthritis of the knee. We gave the rabbits 30 milligrams per kilogram by the oral route of protocotoic acid 3 times a week. And then we also studied it, one from the prophylactic standpoint, where we gave them the protocotoic acid before we created the surgically induced osteoarthritis. And the other group, we created the surgically induced osteoarthritis and allowed it to go for a month before we started treating them. And then we were able to look and see what effect did we have either prophylactically or therapeutically from the oral treatment of protocotoic acid for a surgically induced osteoarthritis of the knee. And we took a look at the histochemical analysis. So the first thing that we wanted to see was what happened to the negative or the catabolic cytokines in the synovial fluid. And what we saw was that they were decreased. So in this particular study, we did add cyanidin 3-glucoside and also protocotoic acid. So you'll see on the slide on the left, prophylactically, both groups, we decreased the IL-1 beta or that negative cytokine. And on the therapeutic group, we actually did the same thing. Interestingly enough, the cyanidin 3-glucoside tended to have a little better reaction than just the pure protocotoic acid. The reason more than likely is that it was harboring more protocotoic acid to be converted to the PCA or the protocotoic acid. And then if we looked at MMP1, which was another negative cytokine, we again saw in the prophylactic group that we decreased the catabolic cytokine in the synovial fluid. And the same thing happened on the therapeutic end. We markedly decreased this negative cytokine. And then MMP13 is another negative cytokine. And we saw prophylactically and therapeutically, again, there was some decrease in that. So what we were able to show is, like every other therapy for arthritis, it had an anti-inflammatory dimension. And so then we looked at IL-4, which is a positive or an anabolic cytokine. And with both groups, they were increased, especially with the protocotoic acid. And so that was a positive thing, not seen with any other arthritis medicine, no anabolic form. And then IL-10 is another positive cytokine in the joint fluid of an animal being treated by mouth for with protocotoic acid. And again, we saw the anti-inflammatory cytokine anabolic increased prophylactic group, ones that had the medicine started before the injury and markedly improved in the therapeutic group, ones in which we allowed the condition to go on for a month before it got treated. And so what we are able to show is, unlike any other existing anti-arthritis medicine, we not only controlled the inflammation, but we also increased the activity of the anabolic form, which could then increase the integrity of the articular cartilage, and it could increase the health and wellness of the articular cartilage. So this particular slide shows the type 2 collagen, and it shows very clearly that when a patient was given this, either by therapeutic or by prophylactic means, that would greatly increase the amount of type 2 collagen, which then holds the integrity of the articular cartilage together in a reparative way. And so here's another example of the control versus the 1 to 42 days was the prophylactic, and the one on the right was the therapeutic, showing that protocotoic acid had a major effect on improving the type 2 collagen amount in the articular cartilage. And again, here's another slide showing the same thing and having statistical significance in the improvements of the amount of type 2 collagen in a articular cartilage with surgically created arthritis. And you see the slides on the right that are colored are histochemical analysis. Then we took a look at International Cartilage Research Society scoring. On the left, you see the control that doesn't have much density to the Sappho staining, which is a dye to show the integrity on a histochemical basis of the cartilage. And on the right, we see the intensity of the red dye showing that the treatment is much better than the control on a histochemical basis of repairing the articular cartilage. And then cartilage is important because it makes a gliding surface and makes the joint go back and forth without catching. And we also are able to see that the treatment with the protocotoic acid by mouth influenced the synovium in an anabolic way. And the control of the gliding surface, you see the thin red line, but on the right, those treated with PCA had a far more increased abundance of articular cartilage lubricant to allow it to glide more effectively. And then the other aspect that's important of the articular cartilage integrity is what's called aggrecan. And here you see the aggrecan with PCA, both therapeutically and uh, prophylactically, showing increased amounts of the gene expression for aggrecan in the articular cartilage, meaning the integrity of the articular cartilage is repaired, unlike seen with any other existing antiarthritic drugs. And so, as we showed you before, greatly increased and enhanced cartilage shown histochemically. But there was one thing that didn't happen with the treatment, and that was that where we created a laceration on the opposite side, very similar to the IGF treatment that we had done in humans. It showed only early sealing down at the bottom of the laceration, but in the period of time of the 6 weeks, it had not completely healed. It's possible that over a longer period of time, that like in the humans that were 13 weeks, or in these that were shorter, that the lacerations may well been healed by the increase of the IGF-1 that happened to occur because of giving PCA by mouth to these animals that had surgically created osteoarthritis of the knee. So I hope that gives you some insight that we have good scientific basis for that. Protocotylic acid given by mouth has both a anti-inflammatory aspect to it, altering and reversing the cytokines within the synovial fluid, but importantly, and unlike any other, it has an anabolic effect where there's repair of the integrity of the articular cartilage. Thank you for listening and look forward to another time with you.